apart from that, we do capacity building as well. So I'm working as the director advocacy with them, and today I'm going to present to you a presentation on the Innocenti Declaration and what it entails when it comes to maternity protection and when it comes to workspaces and creches. Um, Let me share my screen. Okay, so it says that the host has disabled participant screen sharing. Can you help me, Dhanya, with this?
Yeah. Can you share it from there? Can you present your screen from there?
Yes, I'm trying to, but it's saying it is you have disabled it.
Let me just check.
Maybe just allow me to share it. I'll try sharing it again. Yeah, I can now. Thank you. I hope everyone can see my screen now. Can you see my slides? Are my slides visible?
Yes, madam, the slides are visible. You may please proceed.
Okay, all right. Oh, I can't see it now. Internet is acting tricky. Now I can't see my screen. Okay, all right. So let's just start with the presentation quick. I'm so sorry to have wasted some of your precious time. There were some technical errors. So today we are going to talk about a review of Innocenti Declaration regarding establishment of childcare facilities and workspaces. So I would like to start with the history of Innocenti Declaration. Many of you must be attending all of their sessions, and you know when it was launched and what was the year, which was the country. So Innocenti Declaration was actually launched in 1990 first. It was in Florence, Italy, and the key targets of the Innocenti Declaration back then in 1990 were that all countries should constitute national breastfeeding coordinators of appropriate authority, and they should establish a multi-sectoral national breastfeeding committee. All countries should implement the 10 steps to successful breastfeeding at health facility level. Each country should implement the International Code of Marketing of breast milk substitute and subsequent relevant World Health Assembly resolutions. And then also countries should enact legislation that protect breastfeeding rights of working women and establish means for its enforcement. And it was also mentioned and recommended that obstacles to breastfeeding within the health system and the workplaces in the community must be eliminated. So these were the key uh, targets uh, which were there in the declaration in 1990, and it was specifically for protection, promotion, and support of breastfeeding. Moving on to the World Health Assembly resolution. So there was a subsequent resolution in 1990, resolution 43.3, which talked about, which highlighted UNICEF WHO's statement on protection, promoting, and supporting breastfeeding. The special role of maternity services, which led to the Baby Friendly Hospital Initiative in 1992. So let me just, I missed this point. Let me just tell you that who came up with the Innocenti Declaration. It was UNICEF and WHO back then. Then there was a formulation of this WHO resolution, which also urged member states to ensure that principle and aim of the code, the International Code of Marketing, are given full expression in national health and nutrition policy and action. Okay, so then after 15 years, in 2005, in the same city of Florence, WHO and UNICEF met all their partners, and they celebrated the 15th anniversary of the Innocenti Declaration, and they sort of did a bit of taking stock of where do they stand on their targets, whether they have achieved it or not, and they also met to decide new targets for future. So I have here for you specifically mentioned the the targets and the discussions that we had, the recommendation that they had for specifically for maternity protection in the Innocenti Declaration. There were other things also related to breastfeeding which were covered, but we are specifically going to talk about maternity protection here. So they mentioned the Innocenti Declaration 2005 mentioned that countries or member states should adopt maternity protection legislation and other measures that facilitate 6 months of exclusive breastfeeding for women employed in all sectors with urgent attention to the non-formal sector. It also recommended that workplace interventions are most effective when mothers have the flexibility to opt for part-time work. And also, there was a recommendation for trade unions and worker groups as well, that the maternity protection campaign continues to link with trade unions, and trade unions play a very important part when it comes to maternity protection. And they should promote the ratification and enforcement of the provision of ILO, International Labour Organization Convention 183. While there was also a lot of work to be which was done and campaigning which was done for mother-friendly workplace initiatives, which stressed upon employed mothers' need for time, space, and support. Moving on to the next slide. This slide basically showcases, this picture showcases that in 2005, when the Innocenti Declaration 2005 came out, what was the status of maternity protection paid leave back then? So there were many countries who adopted or who made a national legislation at that time protecting mothers, which was about maternity entitlements and ensuring maternity protection. Uh, so it was granted. So here is in this figure, you can see the status of maternity protection by region back then in 2005. So you can see that most of them are some of them are in below 12 weeks, and then there are some of them are at 12 weeks. So it was usually mostly on an average about 12 weeks or nearby that. Then talking about our country context, we had a maternity benefit act back then. It was the previous one was around 1960s, but it was recently amended in 2017 by WCD. Everyone knows that, where we initially had 12 weeks of maternity paid maternity leave, which was extended to 26 weeks for the first two children. So if a woman has worked at least 80 days in the 12 months immediately preceding the accepted delivery date in an establishment or in an office, then she's entitled to these maternity protection or maternity entitlements. So it was initially it was 12 weeks in India, then it was amended in 2017 and it was made 26 weeks. The spirit or attention behind amending this law was that mothers get enough time to exclusively breastfeed their children for 6 months. Then it was also for commissioned and adoptive mothers, they were entitled to 12 weeks. There were provisions of amendments of work from home. The employers may allow a woman employed to work from home post maternity leave for a period and on conditions agreed between the employer and the woman employee. Then there's a provision of creche facilities also in this law, where an establishment having 50 or more employees shall provide a creche facility. Women employees should be allowed 4 daily visits to the creche. And also, employers shall inform women about their maternity benefits that are available to them at the time of their employment. There's one more thing which is missing here is the breastfeeding breaks. So there's a provision of breastfeeding breaks also once women join back to work after maternity leave. She's allowed to take 2 breastfeeding breaks in a day. Moving on to the next slide. Though this law has improved and it has become more robust and it has taken care of the exclusive breastfeeding needs of the mother uh, and the families, but there are some loopholes which are still there in this act. So this act does not cover the unorganized sector, which is 92% of our total workforce. It just covers the organized sector. It does not apply to the establishment with less than 10 employees. So therefore, the unorganized sector is not covered here. And there's no provision of paternity leave in this act. So these are the 3 loopholes which we can see here in this law. Now I'm going to share with you, so BPNI with its policy and program work on breastfeeding and IYCF, we run an initiative which is called World Breastfeeding Trends Initiative, WBTI. So it's a global initiative where we ask countries to assess their country's policy and programs on 10 IYCF and breastfeeding indicators. So one of the indicator of that assessment is maternity protection. In India, for India, we do this assessment, though it is our flagship program, and for India, we host the Indian assessment. And we've done 5 assessments till now. The first one was done in 2005, and the last one was recently done in 2018. So it is said that a country should do reassessment of its policy and programs within 2 to 3 years, every 3 years. So this is how from 2005 till 2018 we have done 5 assessments. So I'm sharing this particular indicator on maternity protection from the WBT assessment of 2018. Though it's not visible here, but I'll read it out for you. So this indicator has subset questions, and in each indicator we give the country score out of 10. So here you can see in the 2018 assessment, India on maternity protection policy and programs on breastfeeding got a score of 6. And if you can see, there are 5 subset questions, and these subset questions are based on that what is the duration of the leave, the paid maternity leave is given in the law, are they paid or unpaid, and then whether the legislation obliges the private sector employees or not. Then is there a provision for national legislation that provides worksite accommodation for breastfeeding and childcare? Is there a space for breastfeeding and breast milk extraction? Is there a space for creches? And then whether women in informal or unorganized sector or agriculture sector are covered or not. So these are the subset questions on which we look for secondary data. We look for data from the government, the policies, the programs, the reports, and then we give these scores to each country. So here in 2018, we scored 6 out of 10, which is better off than the earlier assessments. I'll just show you one of those. So you can see in 2005, these are the 10 indicators which are mentioned here. National policy and program, baby-friendly initiative, implementation of the international code, maternity protection, health and nutrition care systems, and you can read further. So I'll just talk about maternity protection here. So in 2005's assessment for India, you can see that we scored 5 here. And in 2018, we scored 6. So this 1 point increase is because there was an amendment done in 2017 that the paid maternity leave was enhanced and it was made 26 weeks from 12 weeks. So therefore, they got a score extra here. But there's still a long way to go because unorganized sector is not covered, and so we miss out on the total score here, and we're still at 6. Okay, so there's another law which I would like to mention. So I've added this slide in the last minute. I thought we all should know about this also. So there's this law called Building and Other Construction Workers Act of 1996. So there's a booming construction industry in India, and second only to agriculture in terms of employment, and it is estimated to be growing at 15% per year. So it currently employs 35 to 40 million people we have, and it is estimated that that entails 50 to 60 million children. So the law mandates that there should be a creche at a large construction site where at least 50 women, if 50 women are working at a construction site, there has to be a creche with a caretaker or a worker who can take care of the kids. But we've seen largely that this has not been implemented in all the states. The source for particular slide in data is mobile creches. Mobile creches is a very famous organization which work with the on construction sites, and they have mobile creches there, moving creches, schools, education, and they take care of the needs of the construction laborers' children. So finally, coming to the conclusion, so we have I've run through you through Innocenti Declaration, then the WHO resolutions, and then how those are anchored in our country with our laws, with our Maternity Benefit Act, with this particular Construction Workers Act. How they have anchored the Innocenti Declaration. So here we can see and we can conclude that our legislations are good, they're strong, but there's more that can be done. There's more that can be covered, and their implementation can be monitored better so that we know, whether the last mother in the country is being helped and is getting the support. So to conclude my presentation, I would like to say that policies and programs need to be more robust, and it should cover all women and not just a particular sector. There should be monitoring mechanisms, or data must be collected to trace implementation of the Maternity Benefit Act, because we know of testimonies and stories, and you must be knowing women around you who were exploited by their employees, and they were not given their due, and they were bullied when they were pregnant, so that they leave the job and don't claim their maternity benefits. So there are a lot of stories which we do hear, human stories which we do hear about it. So we exactly don't know whether the Maternity Benefit Act provisions are actually taken by the women or not, or they're utilizing it or not. And then also that women need to be made aware about their maternity entitlements. I think we lack there. So we talk about a lot other things, but we being even the ministry which has made the law, and the WCD, they don't promote this much. So there should be a portal where these entitlements and these rights, because it's a basic human right and it's a right of the women and children. There should be a demand for it. So we don't demand it as women. So there should be more awareness about our entitlements, and what are the provisions, so where all we can go, where is the redressal mechanism, all those things. Thank you. I would like to end it here. Thanks, Danya. I'm done.
Thank you, madam. Now the floor is open for questions. I would request the participants to ask their doubts. Those who wish to ask questions may please unmute themselves. Those who wish to ask questions, they may please raise their hands, and from here we can just unmute themselves, and they can ask.
I think everyone understood everything. There are no questions.
Yes, madam, but we have some questions which came up in our YouTube live streaming.
Yes.
One is that, is there any reporting mechanism? A person has asked about the reporting mechanisms which are available if a certain facility or a workplace denies the childcare facilities. I saw a question coming up in the YouTube channel.
Okay, so basically the person who's responsible where you can go and complain is the labor officer of your area. So you have to do a little bit of research and development, go to the labor department's website and look for the list of the labor officers, and then maybe you can contact them. So they are responsible basically for ensuring that Maternity Benefit Act is enforced and that you're getting your entitlements.
Yes, madam. And one more thing is that people are concerned about punishments. I saw another question which is asking about, is there any punishment to the employer if they don't have any facilities like that?
See, it is a law. There would be definitely, because we have known of cases where the mother has sued the employer, and there are judgments available. So you can maybe just go and Google and look for such judgments, where maybe employer, if not imprisonment, they have to pay some compensation or something. But the problem, the issue is that because they bully you and you're already pregnant and you don't want to get into those hassles, and even your family says that, let's just get rid of this, why to concentrate on this? So because the woman doesn't get that support and she's in that vulnerable period of pregnancy, so they tend to just leave it as it is, and that is what the employers exploit, basically.
Yes.
Yeah, so we should first be aware and know our rights. We should know the provisions of the Maternity Benefit Act. Whenever we go for a new job, we should ask from them.
Yes, ma'am.
Yes, and we should ask, it should be in their manuals or in your SOPs, that what are your rights, you should be aware of it, right? And if you are able to identify, for example, if you get pregnant and it's been already 80 days that you're working, so you're entitled to paid maternity leave, but they try to bully you. So you should be aware and not succumb to their exploitation.
Yeah.
Yeah.
Anyone else? Any questions? Ma'am, one question which came up in the chat, I hope you can see that, what measures can be done to improve the benefits of MBA Act to unorganized sector? That's that question about the unorganized sector.
That is actually a matter of advocacy. So there are groups and organizations and civil society organizations who are pushing for it, who are pushing for universal maternity protection and entitlements. So there are a lot of other programs and schemes as well who cover some sort of maternity entitlements, like for example in Pradhan Mantri Matritva Suraksha Yojana, there's a provision of cash benefit, conditional cash benefit. So that is also considered as a maternity entitlement. Then you have the MBA Act, you have the Reconstruction Act. So there are a lot of programs and policy where some benefits are given to mother. But I think I feel like personally, even BP and I advocates for it, that it should be for everyone, for all women. So actually, the issue is that to give it to all women, you need to have that amount of resources as well. So I think the government maybe is trying to do their maths and calculate whether they'll be able to give it to every woman in the country.
Yeah, ma'am. Another question which came up now in the YouTube is that, why can't the government make the breastfeeding corners mandatory in all government offices? Your say on that, ma'am.
Acha, okay, why don't they make it breastfeeding corners mandatory?
Yeah.
Okay, so this issue is also, is quite debatable, and it depends on perception. So there are a lot of women who feel that they want to breastfeed anywhere, anytime, and it should be okay, right? They don't want to get confined to a place. But there are women who want privacy, and we should respect that. But yes, as a support system, to generalize it, we should have these safe spaces and places where, if women want privacy, they can go and sit and breastfeed. But that is also, it's like, it depends on state to state. If they are interested, if there's a political bill, they make it. So we know of certain states who have made on their railway stations, on we see it now on airports also, right? So actually, we have to do more of advocacy and need political will to have such actions at the country level. But I feel that we should just normalize breastfeeding, and women should, like in the way it happens in rural India, uh, women breastfeed anywhere they want and nobody judges them, and it is a culture and it's okay. So there's no obscenity, body shaming in it, and that should be the thing in urban setups also. Yeah. Next, any other question? Manish?
Any other questions? But I was just going to the youth group channel.
Yeah.
As of now, people are saying that it's a good class and all no other doubts, I think. We'll just give 2-3 minutes more.
Okay, sure. Okay, so can I make an announcement, maybe?
Please, ma'am.
Yeah. So I'll share the link also in the chat box. We are launching a mobile app called Stanpan Suraksha. And the key features of this mobile app is that we are strengthening the breastfeeding counseling work in the country. So it will have a repository of lactation counselors available across the country, where mother can download the app and they can look for, on the map, they can look for a counselor nearby them, so she can have access to skilled breastfeeding counseling. And another provision is the law which I was talking about, the IMS Act, which protects breastfeeding. So according to that law, the baby food companies and manufacturers, or bottle feeding manufacturers, they cannot promote food for babies up to 2 years of age. Okay. So if any violation of that that happens, we are gadgeted by the government of India to initiate action. So this app has a feature where, if you as a vigilant citizen find any violation of the IMS Act, you can click a picture, send it to us, and select the category it falls into, and send it to us, and we review it. So we submit a report to Ministry of Women and Child Development every year on IMS Act. And there are other features also of success story, of engaging with us. So we have this webinar on 7th August, 12 p.m. I can share the link in the chat box, or to Dhanya. Maybe she can forward it to you all. Yeah. So you can go to a website, www.bpni.org. There you can find the webinars and you can go and register there. It's on 7th. Thank you.
Any more questions, madam? Today in today's group we have a mix of participants, that is from various government departments, from the health sector, from the district administration, from the labor department and all, and from the program officers and the CDPOs and supervisors from our department.
Okay, so fantastic.
A mix. Yeah.
I think then they all should come to the launch of the app, because they will be like the workforce on the field monitoring the IMS Act. The power is in everybody's hand.
Yeah.
Baby food companies will be more careful and vigilant before undermining breastfeeding.
Tomorrow's session is actually on this IMS Act. We are having.
Oh, wow. Fantastic.
That's by Dr. Rajita Gupta from WHO.
Oh,
tomorrow morning.
Yeah, so it is actually complementing, So if you have this app and you club it with the knowledge you will get tomorrow, you can easily use it.
Yes, ma'am. Ma'am, one more question has come up. Is there any government initiative or any mention in the MB Act about breast milk storage?
Yes, there are guidelines for lactation management units. They call them lactation management units. So formally, there's a guideline for human milk banking. And if you want, I can share the guideline with you. You can share it with the group later.
Sure.
And those guidelines also, they recommend, having a dedicated skilled breastfeeding counselor at each unit.
Yeah, ma'am, one more question. This is like at a scenario where now women are also encouraged to work in the night shifts, that is especially in the MN sectors. Will there be any more hurdles? Is there any special guidelines on that? There's multinational sectors about women working in the night shifts.
See, I am not aware whether it falls under the MBA Act or not, but all the multinationals should abide by the law because they have more than 50 women working with them, most of them, right?
Yeah.
So when it comes to maternity entitlements, they better follow all of it. But I am not sure about, maybe this falls under the labor laws and or the HR laws. It's a different domain altogether. Okay, Manish, I have shared the link of the webinar. People can access it and register themselves there. They can read about our initiative also.
Sure, sure. Yeah. And is there any more questions? So I think, ma'am, there are no more questions on this. Thank you for the support which you have given us today. I would like to take this opportunity to thank you from the Department of Women and Child Development, Government of Kerala, for such an excellent session on this Innocenti declaration and the need for this baby-friendly spaces and in the institutions. So, madam, thank you once again. We'll also support, we'll also try to support on this Stanpan Suraksha, the mobile app, and all from our side. I'd also like to thank all the participants who have been with us from the various departments. We had various assistant collectors, trainee assistant collectors from the departments, from the engineering department, from the labor department, our program officers, CDPOs, supervisors, Anganwadi workers, everybody, and the general public. So once again, thank you so much. And let us work together for health.
So if any of you have any capacity building need also, so you can, let us know on our website. We have a special thing dedicated to training. You can go and check out that also. We are happy to help. So you can write to BPNI when it comes to breastfeeding, any issue, any concern, any help, you can write to us.
Yeah.
Thank you.
Thank you all.